am Dr. BSV Raju, consultant neurosurgeon, Yashoda Hospital, Samajiguda. Often people ask about, is epilepsy curable? Yes, epilepsy is very much managed or controllable in more than 70 to 80% of the patients. It cannot be cured completely in most of the times. And however, drugs will help you to control the seizures in around 70 to 80% of the times. However, in around 20% to 25%, some people may require some kind of a surgical intervention which can control your seizures, and rarely some people can continues to have intractable seizures which may benefit from medication and also to some extent with social support systems and as well as dietary changes. So the first line of treatment for epilepsy is medication, wherein around 70% of the people will get better. We have a lot of newer patient-friendly drugs for epilepsy, wherein they cause less side effects like sedation and giddiness, and at the same time you are able to function, take care of your normal activities with the medication. And in some about, as I told you, in around 20% to 25% of the times, some people, in spite of medical treatment, they may continues to have a significant amount of epileptic attacks. These kind of people may benefit from surgery. The treatment options in this kind of patients can be when something like if a patient is having something like a tumor or infection, usually we call as a lesion associated epilepsy. When you remove the tumor or the abscess or infection, then they get better. Sometimes injury to the brain, like a scar or something like from an injury, stroke or previous infection, can leave a scar that can cause an increased electrical activity, and these kind of things is called as excision of the scar or lesional epilepsy. They can also be controlled with surgery. And sometimes there can be some diseases, they may require some other kind of surgical techniques called as a deep brain stimulation. Deep brain stimulation involves stimulation of the deep parts of the brain to control the electrical activity. How does this act? Normally in patients with epilepsy, they have associated increased electrical activity of the brain. So with deep brain stimulation, there is a synchronization of the abnormal electrical activity of the brain so that it controls the seizure activity in around 50 to 60% of this kind of a patients. Added with medications, these people can do a good kind of a quality of life. And lastly, certainly there is some specific kind of a diet called as a ketogenic diet, which is a high fat and low carbohydrate diet, is also found to be useful, especially in some kind of a resistant epileptic conditions where the medications are not very effective and surgery is not very effective. We can combine this with a ketogenic diet. So with proper guidance, if you are under the right guidance of the right, with proper guidance, I think there's a good chance that epilepsy can be controlled reasonably well. And the important thing in this particular thing is you should reach your doctor at the earliest. And at the same time, people always ask about how well can epileptic patient can lead a normal life. Yes, as I told you, with a good control of epilepsy, 70 to 80% of the people can lead a reasonably good life. They can have a good social relationship, healthy lifestyle, and also can excel in their career prospects. However, they require a lot more support from the society, family, friends, and maybe these kind of people should be given a good support system even at the workplaces. It should be understanding about their needs. And some jobs which require, working in the nights, working close to heavy machineries, driving heavy trucks and all this, these are ideally not recommended for these patients with epilepsy. So with proper guidance, most of the people can lead their near normal life. They can be productive to themselves and their family and contribute positively to the society. Thank you.